Hello, aspirants. I'm Indumati Karthikeyan from Inkar IAS Academy. Today we are going to uh, discuss about the 31st December current affairs, the state and the danger poorly manufactured drugs. It's related to the drug topic. This topic comes under our GS2 government policies and intervention for development in various sectors and also issues arising out of their design and implementation. The topic why it is in the news. First of all, the globalization of the pharmaceutical industry has the potential and rapidly spread. That's a poor quality medicine worldwide before the adequate detection and intervention is possible. So there are two main categories. That is a poor quality medicine, substandard, and also there is a counterfeit. There is a counterfeit medicine also is available. That is a substandard products arise as a result of the lack of expertise, poor manufacturing practices, and also there is a insufficient infrastructure. Whereas counterfeits are the products of the criminals. That is a counterfeits may contain no active ingredients, and also there is a incorrect ingredient which will create a reactions, and also there is a accuracy determine if a medicine is a counterfeits. There's an inspection of the packaging is also required to mislabeling a key part of have been described that, and also in many reports it is unclear there is a poor quality medicine or counterfeit, and also there is a substandard medicine also available in the market. So it is important that we need to classify because they have different region and on different solution. There's an inadequate enforcement, that is a lenient penalties, and also the corruption is a stringent corruption is there, and these are the things will definitely affect the market. And also we need to have some regulation, and we have the unregistered medicine, ignorance of the poor quality medicines among the public and health workers, which exacerbate the situation. So we need to correct on this. So this topic will be discussed by the poorly manufacturing drugs. So we need to regulate to India's drug. That is, India is one of the largest exporter and also largest producer of the pharmaceutical products. So in the world, we catering about 20% of the global demand in the generic medicines. India is among the top 12 destinations for the biotechnology, and also worldwide the third largest destination of the biotechnology is a important thing in Asian Pacific region. And also whereas in 2022 the biotechnology industry has crossed the USD 80.12 billion USD, growing 14% from the previous year. So we have the improving health outcomes, and also we need to focus on the affordable medicine for millions of people across the world, but especially in the developing countries. However, India's pharma industry has also faced several allegations, lots of allegations, lots of counterfeit medicine, lots of problems in the medication sites, and also there's an incident have raised. There's a serious concern about the quality and also the safety of Indian pharma products. The role of effectiveness of the Indian drug regulator surely ensure the compliance, and also we need to come forward for the standard and norms. So we need to first of all, what is the scope of problem? We need to conclude the problem. First of all, there is a prevalence of the poor manufacturing drugs. That is an example substandard drugs like antibiotics and also painkillers are available in our market. And also there is a global statistics on counterfeit, and also there is a substandard medicines will be available in our market. And also there is a consequence of the poor drug manufacturing. First, the health implication, the ineffectiveness, or otherwise it's a toxicity, otherwise it's given resistance for the disease. And also there's a economic impact of the healthcare system. That is a, economically we are not well vested, so we are backward in the economical region. So we are providing the quality is master, so we should not compromise based on the financial stress. So we should concentrate on the quality of the medicine, and also there is a loss of public trust in the pharma industry. So these are the main consequence of the poor drug manufacturing. And also we have the strategic point of view. That is, strategically we need to conclude that the medicine will be safer for the people. We need lots of factor leading to the poorly manufacturing sectors. That is, the manufacturing drugs can be having the various reasons. That is, a lack of adequate regulation and enforcement is the first reason. We have the law, that is a Drug and Cosmetics Act of 1940, which outdated and also it's inadequate to deal with the complexity of the challenge and also modern pharma market. And also there's an act does not cover many aspects like a clinical trials, that's a bioequivalence studies, and also there's a good practice. Manufacturing practice is must, but we don't have any such kind of norms in this Drugs and Cosmetics Act. And also we have enforcement of this act is weak and also the fragmented. So we need multiple authority at the central state level. This is overlapping jurisdiction with that responsibility. So we need to regulate these kind of lacking. And also we have inadequate resources is the second thing. There is a shortage of the manpower, infrastructure, and also there is a fund. These are the things lacking in our system. So there is a no carry out any effective inspection, testing, monitoring, surveillance through these resources. So we need to invest more resources for investment for more resources. And also there is a lack of transparency and also the accountability is also one of the main concerns. That is a Central Drug Standard Control Organization does not disclose much information about the activities, processes, outcomes. So this is a main core concept that there is no transparency in those areas. So we need to concentrate on the transparency. And also we have the allegation of corruption, collusion, and also there is a conflict of interest among the official. So we need to set these kind of norms and regulation, and we need to provide the transparency, and we need to give the accountable for the officers, so they can definitely reduce the poorly manufacturing drugs. And also there is a lack of awareness, and also there's a complaints. Some pharma companies in India add that the prescribed standard and norms for the manufacturing, testing, labeling, packaging, and also the storing and distributing drugs. So these are important things. So we need to restore the ethical practices. They are actually last resort for the unethical, illegal practice. So they can use a substandard or the counterfeit raw materials for the adultering or diluting the drugs, which falsifying the manipulating data, the documents. These are the things increase the profit level, but it will definitely affect the Indian pharma market. So we need to give the awareness and also regulatory requirement guidelines to the people. Then definitely the pharmaceutical industry will definitely boom again. And also some consequences happening due to this kind of medicine, that is an ineffective regulation. So first of all, it will be very much harm for the health, public health. Mainly the poor quality, the safety of Indian pharma product can cause serious harm to public health, and also causing the adverse effects such as allergies, eye infections. Maybe it will possibly damage the organ, and also it may result of poison. It may kill the person also. So we need to take care of the public health, which will not harm for the people. And also they can lead the treatment failure, maybe the drug resistance complication on deaths among patients who suffer from chronic, and also there is a life threatening disease like HIV, so AIDS, tuberculosis, malaria, cancer. So these kind of life threatening disease can be treated by a substandard medicine. It will not cure the disease, and it will not give the solution for the disease. So the people can harm due to this kind of inadequate pharma medicines. And also there is a erosion of the public trust, so which will definitely erode the trust of the people. So they won't go for the medicine. They can avoid the medicine. The healthcare providers of the India pharma products definitely will give the quality of the medicine. And also we need to concentrate on the economic growth. Definitely the pharma industry, the poor quality and safety of the Indian pharma product can cause harm the economic growth, because we are the largest producer and also largest exporter. So it will be definitely affect the global market and system, and also it will lead the loss of market share, revenues, profits. And also India pharma companies, due to bans, recalls, rejection of the product will be foreign regulated or customers, it will definitely affect our quality regime, and also we consequently lead to loss of foreign exchange earnings, employments, opportunities, and also the investment from the foreign countries. So we need to concentrate more on this regulation, and also there is a harm to international relations. The poor quality product definitely can harm the international relation by affecting India's image and also credibility. So, as a responsible and reliable partner in global health initiative, that can create a diplomatic tensions and also the conflict between India and other countries. So, we need to avoid the substandard harmful drugs from India, and also we need to harm to international cooperation. That is again hamper the cooperation, that collaboration with other countries or WHO. So these are the main international cooperation. So these will affect due to this kind of medicine, and also we need to we have addressed common health challenges like pandemics, epidemics. So we have the quality medicine. Definitely we can make our pharmaceutical industries boom. So we need to create a perfect strategy and regulation for this. So what should we way forward? First of all, that we need to amend the Drug and Cosmetics Act, which is outdated till today. So we need to streamlining and also rationalizing the drug regulatory structure, and also we need to create a single central authority for the adequate power, resource, expertise, and also autonomy to regulate the pharma. The entire pharma sector should be regulated by the single autonomy. Then only the corruptions, everything will be reduced. So we need to streamlining the rationalizing the drug regulatory structure and also the function, and also we need to fostering a culture that is a quality and safety among the pharma industry. The government should provide the incentives, a recognition, and also support and guidance for the pharma industry. Will definitely reduce these kind of troubles, and we can definitely increase the pharma industry's profit in regional level and also the international level. Thank you so much.